Hello, good afternoon again. It's a pleasure, as it was just said, to introduce you to the third session of the forum entitled Synergies of the Europe's Beating Cancer Plan and Cancer Mission. Shortly introducing alongside with my colleague Debora, you have heard from us in detail about the context of both programs and flagship initiatives. As you have heard, let me please repeat and emphasize that they covered the entire disease pathway from prevention to diagnosis and treatment up to quality of life. And through these programs, the Horizon Europe and the EU for Health, we have 4 flagship actions funded. ECOS, CCI for EU, Crane and Jane. We have already mentioned briefly in the morning session, and we will have the pleasure to engage with having both coordinators and beneficiaries from Greece to further discuss and learn about the work done. That's it from my side. And Debora, a few words from your side.
Yes, indeed, a few words. Just to say that as long as EU4Health is concerned, so the 2 projects that are going to be presented today are 2 joint actions. So we have Crane, it is a joint action aimed at establishing networks of comprehensive cancer centers, and Jane, that aims to establish a network of expertise. So as I said today, Greece is actively involved in joint actions. So Greece is involved in 7 out of the 8 ongoing joint actions. And just a reminder, so a joint action is a direct grant. So this means that is not does not go through a competitive call and involves competent authorities and, if applicable, also their affiliated entities that are nominated by member states. And for topics like the one that we will hear today, so joint action are the best instrument to implement the activity, because the member states are the only authorities that have the required competence and responsibility to implement the union policies at the national and the regional level as well. And now I would like just to conclude this very short introduction part, just mentioning that HaDEA is supporting Synergies in different ways. So we are organizing internal workshops to identify complementarities, gaps, overlap, barriers, and drivers for Synergies. We are also mapping topics of common interest across different programs. We also promote Synergies through networks and beneficiaries. And also we enhance the visibility and communication of cross-program synergetic results. And also with our presence today here, we want to show really our support to Synergies activities and initiatives.
Thank you, Debora. And with that, let's kickstart the session by introducing ECOS project, establishing of cancer mission hubs, networks, and synergies. ECOS project aims to establish a national cancer mission hub in each member state and associated country. It started its operation in April 23. It's with a dedicated budget of 6.2 million euro. The coordinator is AICIB, Agency for Clinical Research and Biomedical Innovation, and Dr. Anabela Isidro and Dr. Hugo Suarez are in the coordination team. So right now, I have the pleasure to take place on the podium, the ECOS team. I'm sorry for that. Here we are. So it will be Dr. Sofia Xesfingi. She's going to join us virtually. Dr. Sofia Xesfingi is the Horizon Europe National Contact Point for Health and Cancer Mission, Project Manager of Health Network for NCPs in Greece, and Chair of Enterprise Europe Network, ELAS. Then we have here physically with us Dr. Anabela Lopes Isidro, who is, as just mentioned, ECOS coordinator and member of Board of Directors of AICIB and Biomedical Innovation in Lisbon, Portugal. Then we have Yasmin Mohamed Fonseca Fati from the same agency and the team of Anabela. Thank you very much both for being with us. Then we have Laura Motta from the University Catholic del Sacro Cuore in Italy. We have Dr. Marius Mihai Geanta, President and Scientific Lead of Center of Innovation in Medicine, Inomed, from Romania. And also we have Anita Gottlob, researcher at the Austrian National Public Health Institute, as well as Ketil Weideberg, Managing Director at Oslo Cancer Cluster. Thank you very much for being with us. And maybe also, Yasmin, give the floor to you, being the moderator of the session. Thank you very much.
Thank you. And also, I would like to start the session by, on behalf of the ECOS team, to thank ELOC for giving the space for us to advocate for our efforts and also present you what we are doing today and discuss a little bit more about our visions and what we aim that ECOS turns to be in the future. And I would start the session with the ECOS coordinator, Anabela, by asking you what are National Cancer Mission Hubs. We saw and we heard today during the morning sessions, for example, our colleague Ian informing us that soon we will have the pleasure to have a National Cancer Mission Hub in Malta. And yes, what are National Cancer Mission Hubs, and what can National Cancer Mission Hubs do for each member states and specifically for Greece? Thank you, Anabela, for the comprehensive presentation of ECOS. We are doing a lot indeed, and I will piggyback a little bit on what you said in terms of the National Cancer Mission Hubs being a critical framework, not only for communication of information at national, regional, and when necessary, local levels, but also in terms of it being a critical instrument for the implementation of the cancer mission. And another thing that you said was that one of the facets and the transversal facets of the cancer mission is indeed to have the citizens at forefront and at its core. And even though you did not present, I can tell that we have a special work package, a group dedicated to focus on communication, not only project communication, but also communication with citizens and understanding how can we involve citizens. And I will start the discussion with you, Anita. How, in your capacity as work package, as task leader, how do you see the capacity of National Cancer Mission Hubs to engage and involve citizens so that we can share all the information that we are trying to develop here? And also, how can we, the National Cancer Mission Hubs, have the capacity to translate the research findings in, for example, to political action? How do you see this?
Thank you for this question. So I think that in general, the hubs will be able to leverage the shared knowledge from the synergies and all the stakeholders to facilitate capacity building on citizen engagement for the stakeholders on a national level. And this can be achieved in various ways. One of these ways is by providing a number of resources, materials, and also recommendations on how to enhance citizen engagement. For example, the hubs can support their stakeholders in disseminating information to citizens on a local, national, and regional level on current opportunities in cancer, in how to get involved in cancer activities, but also on screening and prevention programs that are available. Another way that the hubs can support their stakeholders is by helping them to collect feedback from citizens, and this feedback is very important. And the hubs can also organize events to give citizens a platform to express and to give feedback on which actions are important to them, for example. And then also a third way is that the hubs can facilitate the development of training and education materials, for example, for healthcare professionals, patient advocates and representatives, and also researchers, of course, on how to best engage citizens and also on how to involve them. But also they can inform citizens themselves on how and when they can get involved in cancer-related activities and which opportunities there might be for co-creation and co-design of these activities on a national level. And I think that based on the work we've done so far in Work Package 6, the added value of having the hubs will be to bring together all this shared knowledge of a diverse range of stakeholders. So it's also multidisciplinary in a way. And to consult these stakeholders on a regular basis, so we can also see changes and on current gaps, but also good practices, not only on a national level, but also, of course, using the whole network of other hubs and of good practices that are available in other countries, maybe that could help on a national level. One example of a work that we have been doing in Work Package 6 is a recent survey on citizen engagement that we have sent to all ECOS partners, and we've collected insights on current methods, processes, and also regulations in their countries on citizen engagement. And here we can see that just one example of many of the results of the survey, but one example was that many respondents indicated that there's a lack of monitoring mechanisms for evaluating the current level of citizen engagement or just different citizen engagement activities. And so this lack will also, so there's just room for improvement in this area. And this is just an example of how these perspectives and insights can help to then generate and draft tools for improving these areas. And then there was a second question on research. And here again, it's all about creating synergies and cooperations. And I believe that the hub can help in this way to facilitate knowledge exchange between researchers and policymakers. And also this will help to create an understanding on where policymakers can or how they can best allocate funds based on new evidence that was generated. Also, the hubs can serve as a bridge between the cancer mission and the activities and new evidence that is generated in research across EU countries, and then serve as a bridge and bring this knowledge to the national level and also to their research network and stakeholders, and help to foster a dialogue with policymakers.
Thank you. Thank you, Anita. You touched in some critical points for the perfect segue for my next question. I believe we have Sofia digitally with us. Yes. Okay. Perfect. So my next question will be to Sofia, given that, and also following up on what Anita just said in terms of resources, all the resources that we within ECOS and also what the future National Cancer Mission hubs will also put forward in terms of resources, materials, guidelines, and tools, and in terms as well as allocation of funding, and for us to try to have the ecosystem more capable of this coordinated response in fighting cancer. I would like Sofia, as the Greek NCP for the cancer mission, how do you see the role of national contact points within the cancer mission, as well as how can, for example, national cancer mission hubs and the national contact points work together in order to maximize the impacts of all of these resources.
Καλησπέρα και από μένα, δεν ξέρω αν ακούγομαι. Θα κάνω την διαφορά και θα μιλήσω στα ελληνικά. Μιας και όλο το event είναι για την συνεργία μεταξύ του και την δημιουργία του Εθνικού Στρατηγικού Σχεδίου για τον Καρκίνο στην Ελλάδα. Να πω ότι στο ΕΚΟ συμμετέχουμε ως task leaders στο κομμάτι των συνεργειών. Και αυτό ακριβώς είναι και το ζητούμενο, στην ερώτηση που μου έκανε η Γιάσμιν, αυτό ακριβώς είναι το ζητούμενο, στο να μην σπαταλούμε πόρους και να έχουμε το μεγαλύτερο δυνατό αποτέλεσμα με τη μικρότερη δυνατή προσπάθεια. Πώς γίνεται αυτό? Από τη στιγμή που τα εθνικά σημεία επαφής σε κάθε χώρα αποτελούν στην πραγματικότητα μια πύλη εισόδου, μια πηγή πληροφόρησης για όλους τους ενδιαφερόμενους φορείς, για να συμμετέχουν σε προγράμματα ερευνητικά και για να απορροφήσουν χρήματα ευρωπαϊκά για την καταπολέμηση του καρκίνου. Υπηρετώντας όμως έναν από τους πυλώνες είτε της αποστολής για τον καρκίνο, είτε του Europe's Beating Cancer Plan. Okay, I've just been informed that you are not wearing your speakers, so your auricularies. So I have to switch in English. That's correct?
Yes, but we trust that everything that you said is it's the perfect answer.
Okay, I will be short then. I just mentioned that as NCPs in each member state, our basic responsibility within our role is to be the information, let's say, gate for all stakeholders in order for them to get and claim, let's say, money, budget, European money for beating cancer across Europe. Or for serving one of the pillars of the cancer mission. So how can you do that? Only by creating synergies and not waste any resources. We need to put all our efforts collaborating with each other in order to gain the maximum outcome with a minimum effort. So my main goal, let's say, within ECOS is, first of all, to create all synergies, first of all, within Greek regions. It's very difficult. Although I am the NCP for Cancer Mission, for example, it's very difficult for me to provide relative information to all stakeholders, to all regions across Greece. You have heard since this morning that Greece is quite peculiar, has specific characteristics in geographical terms. So the National Cancer Mission Hub would be responsible for providing this information. I would be under the umbrella of the hub, the National Hub, in order to provide all relative information to all stakeholders across all regions in our country, and of course in the rest of the countries participating to the cancer mission and the Europe's Beating Cancer Plan.
Thank you, Sofia. And exactly. So I agreed. So national contact points should act as the gate of information. So the future national cancer mission hubs should have a great proximity with their national contact points, being cancer mission and other missions, given that the National Cancer Mission Hub aims to have a more holistic approach to fighting cancer, does the synergies with health and also beyond health and cancer. But understanding that, for example, National Cancer Mission Hubs aim to generate this feedback loop within and from the cancer ecosystem, and also having Sofia's feedback on what should be the role of national contact points, I ask you, Marius, how can national contact points and national cancer mission hubs work together to ensure, for example, a co-evolution of the initiatives within cancer mission, And also, as Sofia said, it's difficult, for example, to reach regional and local levels in terms of health policies. So how can national contact points and the hubs work together?
Thank you, Jasmine. I will start by saying that one of the beauties of and strengths of the ECOS project is that you cannot know what to expect. Because there are so many, and you presented, Anabela, are so many initiatives ongoing, different projects that started actually to deliver different things. And the way ECOS Consortium and our work is organized actually allow different groups, people, consortium projects, allow them all actually to inform the development of the National Cancer Mission Hub. So I think this is really, really great, because at the beginning, we had an idea about the cancer mission in general, probably an idea about the National Cancer Mission Hubs. I have to say that I didn't have like a vision at the beginning, but I learned a lot. I learned in this first year. So it's actually a space for everybody who should have a say when it comes to cancer control. And I think this is the opportunity through the cancer mission, to contribute to the cancer control in a slightly different way, compared with what we're used to see when it comes to cancer topic in general. And I'll not call it necessarily the traditional way, a top-down, but more or less is the same. And we actually heard a lot of opinions, including today, about the limits of the current way the cancer or health systems are organized. But having this cancer mission approach, actually, we are in the position to build a bottom-up approach. And as you said, Anita, to include citizens is so important to capture the opinion of the citizens, then to activate them. And I think it's so important to keep them activated, to inform us from prevention to screening, where the input of the citizen is so direct. But we have some data from previous studies showing how important are the attitude and perception of the citizen when it comes to a perception on cancer innovation in diagnosis and treatment, fatalism and stigma. So it's really important to be able to capture this and to include this assessment or the data coming from assessing the citizen perceptions, the community and societal opinion or insights, and to include this in, let's say, the formal way of looking to the cancer topic. Here is the point where I think the cancer mission hubs, National Cancer Mission Hubs, will play a key role, and would not be an easy task. Because this required, I think, and we've discussed about this, a different model of governance. The pentahelix model require a different model of leadership. So we should be aware, or we should avoid that an institution or a person to patronize a National Cancer Mission Hub. So this should be an expression of really democratic spirit, but for the benefit of the citizen and patients and society and communities. And I will end my intervention by saying that cancer is a priority at European level, and cancer mission as an approach or tool emerge as a consequence of the failure of the, let's say, traditional way of dealing with cancer control. So emerge in order to cover a real need of the individuals, of the persons, of the patients. So it's not philosophic or it's not something philosophic, something really practical. And we should allow us to have enough time, because we are actually at the beginning, to have enough time to demonstrate what this bottom-up approach can add on to what cancer control is, according to what we know for many years.
Perfect. Thank you, Marius. And also, you said that maximizing efforts and in terms of cancer control, giving a value proposition of what is actually cancer control and what cancer control should be, having more of these perhaps not vertical communication and vertical way of doing things, but more horizontal. And just what you and Anita and also Sofia said, we will have a lot of resources, materials. We are doing a lot of efforts in order to, as Mario said, to explain how things should be done. And also piggybacking a little bit on what Anabela said, that we are right now working in silos. And what ECOS wants to do is breaking these silos and not duplicate efforts. It's something that we should really emphasize, that we want to work with everyone. That's why we want to be the structure to coordinate cancer efforts at national level. How can we, Laura, in your aspect of also task leader in terms of synergies, maximize these efforts that we are trying to do? How can we not ensure that we are not duplicating efforts, we are not overlapping with any other initiative and any other program? How can ECOS and National Cancer Mission Hubs, of course, ensure this?
So we use this word synergy a lot of time. This is the magic word. It's easy to say synergy. It's a little bit more difficult to create effective synergy. So the strategy that we have implemented in ECOS started with a first mapping. And we started the mapping from the partners of ECOS, because actually most of the partners are involved in a lot of initiatives. They have a lot of experience. And we try to ask them, in their opinion, what are the projects, what are the initiatives that we needed to take into account. And we ended up with 68 projects. And we contacted all the 68 projects. We asked them to fill in a survey just to understand in which areas we could create synergies. And we also, and with those that replied, we also tried to create a link, appointed ambassadors. And after that, we thought it was not enough already. And we complemented the mapping, integrating the analysis, also using the just released tool of the European Commission, the Cancer Project tools. And we connected also with additional 16 initiatives that the tool suggested are in the same areas of ECOS. The problem is now that we need to create synergies and we need to somehow prioritize these synergies. And we decided to have a concrete approach. So to study all these initiatives that we selected and try to understand if they are developing concrete tools in the time frame, in the actual time frame of ECOS, to understand if they are producing something in which we can contribute, and also if they can contribute to our work as well, because synergies is always in both sides. So we give results and we hope that these results are exploited by other initiatives. And on the other side, we need to take on board the results produced by other initiatives. When we did and we are still actually doing this prioritization exercise, we focus, of course, or actually we based on the 3 intervention areas of the cancer mission. The 3 intervention areas, and I think that you know them by heart, but I repeat them, are prevent what is preventable. The second one is optimize diagnosis and treatment. And the third one is support the quality of life. In the area of prevent what is preventable, we try to find initiatives that are developing tools that can be exploited and used and be helpful for national cancer mission hubs. For example, we try to liaise with the PROPHET project, which is a CSA funded by the Horizon Europe, Prophet is developing the strategy for the research and innovation strategies for personalized prevention. And they are also including, they're working on a framework to assess and implement personalized prevention strategies in Europe. Then we know that we need tools to connect and engage patients. And for example, we are trying to connect with the 4PCAN projects, which is producing also tools for managing living labs. So this, yeah. And but there are many others. So for example, the TOGAS project that was also in the slides is preparing frameworks to develop and implement novel cancer screening tools for gastric cancer. But we think that the tools that they are developing, maybe they will be useful and can be exploited for other type of screening, other type of cancers. So it's really an intense work of reading and studying all what the other initiatives are doing. In the second areas of optimized diagnosis and treatment, there are key synergies with the Jane, CCI4U and CRANE, but I will not talk about them because we will see the presentation afterwards. And finally, in the support and quality of life, there are also very interesting initiatives we are trying to liaise with, for example, but this is just, this is not the complete list, but for example, the EUQUAL projects wants to develop now the guidelines for the toolkit for assessing the quality of life of cancer patients and survivors. Or, for example, the ECAN projects wants to develop their roadmap for sustainable implementation of health initiatives in cancer care. The WECAN initiatives will support us for providing ideas and guidelines for networking for European patient advocacy, for example. So there are a lot of initiatives that we need to take into account, but we need to build the synergies on concrete tools and concrete strategies. And last thing that I want to say is that what we are developing is of course focused on cancer, but is actually contributing in general to create a more sustainable, a more efficient, person-centered health and care system. And this is the goal of another initiative at European level, which is the European Partnership on Transforming Health and Care Systems, which is actually has put a lens on what we are developing, because we know that the partnership knows that what ECOS and the other initiatives are presented are aimed to really impact on the health and care system. The European partnership that I'm also happy to work on because we are supporting the Italian Ministry of Health that is coordinating it, is also developing several interesting tools, like, for example, frameworks for the best practice transferability, or tools for bridging research and policymakers. And also to support the ecosystems, the health ecosystem, also through capacity building activities.
Thank you, Laura. You touched upon the point of sustainability. And the truth is we are working a lot and developing a lot of things that will be useful, not just now, but in the future as well. And when talking about synergies, we also have to ensure that the work that we are doing doesn't stop now, doesn't stop upon the 3 years of life of the project. And I would ask you, Kjetil, in your vision of businessman, what is your vision for the future of the cancer mission in regards of the framework program 10 that we will have? And also, how can we ensure that national cancer mission hubs also are valuable towards 2030 when we hopefully reach our goal of saving 30 million lives and onwards too?
No, the short version is that I think Europe can be the world center of cancer innovation. And that is a task where, as we heard earlier today, companies need to work together with governments and all the players in the pentahelix. In the last decade, I've seen this myself as I work in Oslo Cancer Cluster, where you have members from hospitals, research institutes, companies, investors, etc. And Norway have no large pharma company as from Norway. But we have, through this ecosystem, generated billions of euros in value validated by investors. So I think that it's not a perfect model in Norway. That's not what I'm going to say. But I think that we can, in Europe, be a center of cancer innovation. And there are a couple of things that's a reason for that. And one is that even except what you read in the newspaper about the healthcare systems in your country, Europe has the best healthcare systems in the world. Simple as that. So every country that you can read that is bad, but in average, Europe has a very good healthcare system, and they are public and universal mostly. Secondly, we have in Europe, we have healthcare data, which is unprecedented in most parts of the world. And I think that, and thirdly, we have some of the best research in the world in Europe as well. So all these ingredients can help us to develop Europe as a leading cancer innovation hub. Then if you look at some concrete areas, so one is that by using this infrastructure in Europe, we can halve the development time of new cancer treatments and diagnostics. So how could we do that? We talked about earlier today how AI transforms innovation. So if you look at AI used in preclinical development, it will change. Why wouldn't we set up Europe to do that? Secondly, if you look at clinical trials, we talked earlier today about real-world evidence. No place is better suited than Europe. We have the Darwin project that has some of this. We should look at innovation in that part. In that part, we can reduce the time of clinical trials significantly. And then if you take that into account, the cost of medicines, when we reduce the time, would also change. The second point is to look at prevention. That's also been discussed many times today. How do you pay for prevention? How do you get a politician to put money into that? It's difficult. We have some screening programs, it works. But I think we also have to think, since we have a universal coverage of our population, how can we build an economic, sustainable model to intervene early and to actually do real preventive actions, also secondary prevention? And thirdly, we have what we are representing here today. We are setting up a structure of hubs when it comes to cancer. And this is kind of an early model if you think about how is Europe going to operate. So we think it's fairly natural that there is a disease control office from the US government in each state. So why wouldn't we set up so that we also can have a unified systems of how we work in Europe? Well aware that each country needs to have own control over their own health cost, but then we have a structure to do this. And if you take that further, we could look at efforts like the Warp Speed project when US reacted to COVID fast, changing, enabling that to do. We can do that in Europe as well. So it's maybe a long answer, but I think that this is visions that we can do in Europe. I think it's possible, and I think we are just starting this by ECOS and creating these national cancer mission hubs.
Thank you. I think we can end on this hopeful note that possibly till 2028, for the FP10, we can continue to support ECO's endeavors and also the National Cancer Mission hubs and of course the Cancer Mission. I don't know, Anabela, as coordinator, do you want to say anything? No. Okay, so thank you once again to ELOG for considering this the space for discussing ECOS.